Before we start discussing which exercises you should do, let's first start with what you should not do. First of all, tendons don't get better by rest. While you might get away with general rest in case of reactive tendinopathy, not loading your tendon will never help with a tendon in a stage of late disrepair or degeneration, as it further decreases the tendon's capacity to take load. In our experience, most patients involved in overhead or racket sports report pain improvement when they stop their sport, but actually experience more pain and disability when they try to pick up their sport again after the break. Furthermore, recent research has shown that the inflammation seen in tendons is not the classical inflammation we see in other tissues of the body. On top of that, the literature shows that we are not able to change the pathological part of a tendon. For these reasons, treatment options directed at decreasing inflammation or at changing the pathological part of the tendon don't make sense. Let's now look at a possible rehab program that does make sense. Number 1, decrease aggravating high and fast load activities. Like in other tendons, high and fast load activities, meaning that the tendon has to store and release energy quickly, are the main driver behind tendon overload. This is also why golfer's elbow is often seen in overhead athletes or racket sports that make use of the elastic action of the tendon at the elbow and wrist when throwing or hitting a ball. While it's not necessary to stop all high and fast load activities, it is recommended to reduce volume, so either frequency, duration, or reps and intensity, to a level that the patient's pain aggravation settles within 24 hours after the activity. So in my personal case, I reduced the numbers of times I played per week from 4 to 2 or 3 and tried to avoid playing on consecutive days. Furthermore, I tried not to play matches in order to avoid serving. By doing this, I was able to break the downward spiral of my elbow getting worse and worse until pain stayed on a stable level at least. Number 2, adjunctive options. Some patients have positive experiences with the use of braces, kinesiotaping, dry needling, massage or ice. While these options can be added based on patient and therapist preference, be aware that none of these options will increase the tendon's capacity to bear load in the mid and long term. In my personal experience, the use of ibuprofen has a positive short-term effect on tendon pain and stiffness. Literature has also shown that it inhibits the expression of key ground substance proteins for tendon swelling in vitro tendon preparations. At the same time, you don't want to end up being dependent on medication for more than a week or 2 that can possibly cause stomach problems.